When we think of lowering our blood pressure, we normally think of restricting our intake of salt and processed foods. A heart-healthy diet, however, involves more than merely limiting your sodium intake. The DASH diet, Dietary Approaches to Stop Hypertension, emphasizes eating plenty of fruits and vegetables, low-fat dairy, and other fiber-rich foods to help lower blood pressure. Incorporating many of these blood pressure-lowering items into your diet might be an effective way to start living a healthier lifestyle. There are even meals that can help you lower your blood pressure immediately so you can get started on your path to improved health. 1. Low-fat or fat-free yogurt. Low-fat dairy products are high in calcium, which is one of the primary substances that helps to lower blood pressure. Yogurt has potassium, protein, vitamins, and minerals that are beneficial to your diet. A 12-ounce serving of low-fat yogurt has approximately 30% of the daily calcium requirement. 2. Berries. Blueberries and strawberries contain antioxidant chemicals known as anthocyanins, which are a form of flavonoid. In one older study, researchers examined data from nearly 34,000 participants with hypertension during a 14-year period. Those who consumed the most anthocyanins, primarily from blueberries and strawberries, had an 8% lower risk of high blood pressure than those who consumed the least anthocyanins. 3. Citrus fruit. Citrus fruits like grapefruit, oranges, and lemons are full of vitamins, minerals, and plant compounds that may help keep your heart healthy by reducing risk factors for heart disease like high blood pressure. A 2021 study reviewed the last 10 years of data on fruit and management of high blood pressure, and found that consuming roughly 530 to 600 grams of fruit per day, about 4 oranges, was beneficial for lowering blood pressure. Orange and grapefruit juice may lower blood pressure when consumed. But before including this fruit in your diet, talk to a doctor because grapefruit and grapefruit juice can interact with major blood pressure lowering drugs. 4. Bananas. One medium-sized banana contains roughly 420 milligrams of potassium, making them a potassium-rich food. This amounts to around 9% of the daily recommended requirement. Research has found that diets deficient in potassium are linked to greater blood pressure. Potassium is excellent for controlling blood pressure. Additionally, high in fiber, bananas give smoothies, baked foods, and frozen desserts a naturally sweet flavor. When mushy bananas begin to spoil, peel them and freeze them. 5. Salmon and other fatty fish. The omega-3 fats found in fatty fish are a great source of these health-promoting fats for the heart. These fats may lessen inflammation, hence decreasing blood pressure levels. The association between omega-3 fatty acids from the diet or supplements and blood pressure was examined in a 2022 study that examined 71 studies and health data from 4,973 individuals. A daily intake of 2 to 3 grams of omega-3 fats, equivalent to 3.5 ounces of salmon, had the greatest effect in lowering blood pressure. Young persons without a history of heart disease or diabetes may experience a lower risk of high blood pressure if their diets contain more omega-3 fats, particularly fish. 6. Leafy green vegetables. The high nitrate content of leafy green vegetables helps control blood pressure. According to some research, consuming at least 1 cup of green leafy vegetables each day can lower blood pressure and lower the chance of developing cardiovascular disease. Cabbage, collard greens, kale, mustard greens, spinach, and Swiss chard are a few examples of leafy greens. These leafy greens are a good source of minerals including magnesium and potassium, which help to maintain healthy blood pressure levels. For instance, 1 cup, 175 grams, of cooked Swiss chard provides 20% and 36%, respectively, of your daily requirements for potassium and magnesium. A 2022 study discovered that among females with high dietary sodium levels, every 1 gram increase in potassium was associated with a 2.4 mm Hg reduction in systolic blood pressure. 7. Nuts and seeds. The consumption of nuts and seeds may lower blood pressure. Pumpkin seeds, flaxseed, chia seeds, pistachios, walnuts, and almonds are a few examples of nuts and seeds to take as part of a balanced diet intended to lower blood pressure. Numerous nuts and seeds provide a concentrated dose of nutrients necessary for controlling blood pressure, such as fiber and arginine. Nitric oxide, a substance necessary for blood vessel relaxation and lowering blood pressure, is produced from the amino acid arginine. Clinical investigations have produced conflicting results, despite some research suggesting a link between eating nuts or seeds and decreased blood pressure. Researchers may be able to better understand how nuts and seeds can lower blood pressure with longer investigations. 8. Beets. Because beetroot juice includes dietary nitrate, drinking it may both temporarily and permanently lower blood pressure. In a 2015 study, it was discovered that persons with hypertension whose blood pressure was lowered by drinking 250 milliliters, or about 1 cup, of red beetroot juice every day for 4 weeks. Over a 24-hour period, the researchers observed an average drop in blood pressure of 7.7, 5.2 millimeters of mercury, mHg. Tips that are useful include: daily consumption of 1 glass of beetroot juice, serving salads with beets, cooking beets to serve as a side dish. A serving of beets is roughly 1 cup, which is equivalent to 2 small or 1 large beet. 9. Garlic. Many of garlic's antibacterial and antifungal activities may be linked to allicin, the major active component. According to a review published in 2020, garlic in general, and kyolic garlic in particular, can lower cholesterol, blood pressure, and vascular stiffness. Stir-fries, soups, and omelets are just a few of the savory dishes that garlic may improve in flavor. It can also be used as a flavoring in place of salt. 10. Oatmeal. The oatmeal is one of the high-fiber whole grains that has been related to a reduced risk of cardiovascular disease. It also aids in weight loss and may lower cholesterol. 3 servings of whole grains a day, according to studies, can cut your risk of heart disease by 15%. Breakfast oatmeal is a fantastic way to start the day with healthful grains. Lunch and dinner should include whole wheat bread as well as quinoa, barley, or brown rice. Among the ways to eat oats are: breakfasting on a bowl of oats, giving burger patties texture by adding rolled oats rather than breadcrumbs, sprinkle them on sweets made with yogurt. If you like the video, please like this video and subscribe our channel. And don't forget to press bell button below this video to get future video updates.